Am I a true candidate for fat freezing, or would another treatment work better? What is the risk of PAH after I do fat freezing? And how often have you seen it? Would you ever recommend liposuction instead of fat freezing? Reconsider if you're hearing dialogue like there are no side effects.
Fat freezing. 20 questions you need answered before you book.
BeautySeek is not a medical provider. This is not medical advice. Always consult a licensed professional.
Number 20. How much fat goes? Volume reduction.
How much reduction should I realistically expect from fat freezing? What you want to hear is around 20-25% reduction of the fat layer per treatment. Subtle contour refinement, not dramatic transformation. Reconsider if you hear comments like, you'll lose inches immediately, or you get promises of dramatic reshaping.
Number 19. When does frozen fat go? Metabolism.
How soon will I see results after fat freezing? What you want to hear, you'll receive a gradual change over 1 to 3 months, and patience is required. Reconsider fat freezing if you hear conversations like immediate and dramatic claims.
Number 18. How many sessions? Treatment plan.
How many fat freezing cycles or sessions will I likely need? What you want to hear is a plan based on your anatomy and an explanation of why one versus multiple cycles. Reconsider fat freezing if you hear, well, let's just start here and see, or no conversation about a structured plan.
Number 17. Skin tightening. Reality check.
Does fat freezing tighten skin? What you want to hear is minimal skin tightening, or you may need another treatment. Reconsider fat freezing if you hear promises of firm skin tightening.
Number 16. Can FAT return? Long term.
Can fat come back after fat freezing in the same area? What you want to hear is that treated fat cells are reduced and remaining cells can enlarge with weight gain. Reconsider fat freezing if you hear it's permanent, no matter what.
Number 15. How many applications? Coverage.
How do you decide how much area to treat when fat freezing? What you want to hear is comments that are based on contour goals, not just upselling to more zones. Reconsider fat freezing if you hear pressure to treat everything.
Number 14. Does it look uneven? Contouring.
Can fat freezing results be uneven? What you want to hear is, yes, symmetry planning matters, and a follow-up assessment is included. Reconsider fat freezing if you're hearing guarantees about symmetry.
Number 13. Type of device? Old or new?
What device are you using to freeze my fat? What you want to hear is FDA-cleared device name, specific applicator explanation. Reconsider fat freezing if you get vague answers or off-brand device with no clarity.
Number 12. Custom device? Applicator fit.
How do you choose the right fat freezing applicator for me? What you want to hear is based on the fat thickness and contour of your body, or a measured assessment, not guessing. Reconsider if you hear, we use the same one for everyone.
Number 11. Properly screened? Safety.
Are there medical conditions that make fat freezing unsafe? You might want to hear a dialogue about cold-sensitive disorders. Reconsider fat freezing if you're really not getting an answer about any kind of a medical screening.
Number 10. Can fat harden? Tissue risks.
What is the risk of PAH, paradoxical adipose hyperplasia, after I do fat freezing? And how often have you seen it? What you want to hear is an acknowledgement that PAH is rare but real. You'd want to have a transparent discussion and maybe a management plan if it occurs. Reconsider fat freezing if that conversation never happens with your provider or you receive a dismissive tone.
Number 9. If fat hardens, what's the plan?
What happens if I develop PAH? What you want to hear is a referral to surgical correction or an honest discussion that surgery may be required. Reconsider fat freezing if you hear minimization of the question or complete avoidance.
Number 8. Downtime? Over lunch?
What does recovery actually feel like after fat freezing? What you want to hear is numbness is common, swelling is possible, and you could have temporary soreness. Reconsider fat freezing if you hear there's no downtime at all.
Number 7. Numbness? Pay attention.
How long will numbness last after fat freezing? What you want to hear is a conversation that usually waits, rarely longer, and an explanation of how nerves cooled. Reconsider fat freezing if you hear it won't happen.
Number 6. Common side effects? What's normal?
What are the most common side effects you'll experience from fat freezing? What you want to hear is redness, bruising, temporary numbness. Reconsider if you're hearing dialogue like, there are no side effects.
Number 5. Abnormal swelling? Be aware.
What does swelling look like versus something abnormal after a fat freezing procedure? What you want to hear is a clear description of normal inflammation and instructions for concerns. You might want to reconsider fat freezing if there is no post-care guidance.
Number 4. Who protects you? Supervision.
Is fat freezing medically supervised? What you want to hear is discussion of a clear supervision structure and that you're working with a trained operator. Reconsider fat freezing if no one gives clarity to who is overseeing the operation.
Number 3. Unhappy with results? Revision.
What happens if I'm unhappy with my fat freezing results? What you want to hear is honest policy, whether retreatment is possible. Reconsider fat freezing if there is no plan.
Number 2. Do you have the right body type? Is this for you?
Ask, am I a true candidate for fat freezing, or would another treatment work better? What you want to hear are phrases like, you have localized pinchable fat, you're near your goal weight, your expectations are modest and contour focused. Reconsider fat freezing if you're hearing it being positioned as weight loss or no one assesses your skin quality or fat thickness.
Number 1. Not qualified for fat freezing? Is surgery an option?
Would you ever recommend liposuction instead of fat freezing? What you want to hear? Honest discussions of limitations and willingness to say surgery may be more effective. Reconsider fat freezing if you hear non-surgical is always better.